Hi, I'm Sherry Harlan Davis, program host for Reid Beside You. And today, our special guests are Craig Kenyon, CEO of Reid Health, Dr. Clemente, our Chief of Staff, and Tom Hilbert, our President of our Governing Board. Welcome, gentlemen.
Thank you.
Thank you.
Thank you. Nice to be here, Sherry.
And today, we have some real exciting news. And we're going to talk about the Reid mission, vision, and values. So I know that one of the first things we're doing is Reid is updating their mission. So how long has it been since Reid Health has updated the mission?
I'll jump in here
And
first.
I'll jump in with you, Craig.
Sherry, it's probably been about 30 years. It was time probably last when the hospital changed its name from Reid Memorial Hospital to Reid Hospital and Healthcare Services. And back 30 years ago, a mission statement was probably the all-inclusive for everything. It was a much longer than you would see mission statements today, and didn't include a breakout for vision and values. It was more or less lumped into what was under the umbrella of a mission statement. So it's been a long time, but on one respect, the other respect, it was such a good mission statement, it stood up under the test of these years.
And that's pretty impressive. One of the things when you're saying about, I can always tell in the community, usually the age of a person, if they ask me that, am I going to Reid Memorial Hospital? So that's always a statement of usually the age.
Yes.
Then, so why was it important to update the mission now?
You know, Sherry, I since those days when you referred to it as Reid Memorial Hospital, a lot has changed. Reid has grown exponentially since that time and has now become a full-service regional hospital servicing many counties. And of course, with the changes in healthcare, our focus has changed somewhat more to be more inclusive in looking to improve the well-being of every single individual that's actually in our area. So it was time to recognize that change in focus.
And before we go any further, I just want to read the mission statement. It's actually going to appear on a slide for our viewers, but it's wholeness in body, mind, and spirit is basic to fulfillment of human potential. Reid Hospital and Healthcare Services, and that's another name before Reid Health. And its people work with others to enhance wholeness for all those we serve. Our convictions include commitment to compassion, service, excellence, value. These convictions are expressed daily through care principles, the active demonstration of courtesy, attitude, respect, enthusiasm. These principles are directed towards those people we are privileged to serve and among all of us who serve. So we can tell it's very wordy from what we're trying to move forward to. So, and another thing is, what did the process look like as we were moving to change the mission? Can you give me an idea? And also, like, who was involved?
Tom, you want
And I might have Craig.
I'll defer to Craig on the whole process, but I can tell you that we sent two very well qualified individuals from the governing board to fully participate in that process. So we feel that we were represented well, and that I think both of those individuals would say this new mission, vision, and values better reflects what the board is looking for. And Craig can talk to you maybe a little bit more about the nuts and bolts.
Sure. Well, as you just read that mission statement, Sherry, that was part of the first work that they did. We weren't looking for revolution or looking for evolution. We wanted to carry this forward in a slightly different way. So they started with a structure of looking at the current mission statement. And how did you morph that into a smaller, more condensed set of words that still conveyed a strong meaning? No small task to do that, but that was their charge, try and do that. And how did that statement truly reflect Reid today? You know, we weren't here 30 years ago. Many of us were not. So we have to look at putting this out today. Does this reflect who we are today? And that was the acid test for the group, to make sure that we were getting the best of what we're doing right now identified, because this is how we communicate what the expectation is for patients to come here. So it had a lot of real discussion as to what do we want the end impact to be when somebody reads the new mission statement. So that was part of setting those guidelines in place first before anything was put pen to paper to put words behind it.
Another thing I'd like to ask, and to make sure the community realizes that we went to all levels of the organization was included. So Tom had shared that we had 2 members of the governing board very instrumental in a lot of the meetings and planning. And I'm going to ask Dr. Clemente, how's that, as well as getting input from the medical side?
Well, we included some medical staff leadership as well as other physicians and providers in this discussion. And if you look at the new mission, which is to lead our community in well-being, one patient at a time, this in a nutshell looks at where we want to go. Oftentimes as providers, it's quite easy for us to be in a room with a patient and to focus on them in that clinical setting, whether it's the exam room, a procedure room, the operating room, or even an imaging room in radiology. It's easy for clinicians to forget that this person with this disease state exists organically outside in the community, that the disease affects the community even before they come to our care and will affect the community after they leave our care. So the important thing for us as clinicians was that part, that to lead the community in well-being. Of course, we've been doing that, right? It's the mission of Dan Reid to always help the community, even as he went to New York and sent money back to help the community. But I think it's important to refocus that again now.
Great. And Craig, can you share again, when I was explaining about like all team members, just from the top to the bottom, how people are always included in our various decisions?
Sure. And we always start at the top with the board and getting their input. But we brought in all kinds of different individuals from different areas of the organization. We also sent out a survey to get information about what they liked about the mission statement we currently had and so forth. That went to all users. So all of this input created some commonality back. And from there, you started to see where we're lining up as where people were seeing what the current state of Reid looks like and where we could segue some of the pieces and parts said a little differently from the old mission statement. But it was top to bottom and also additional input from the community. And as a reminder, our board is a representation of the community. So that is a big piece of what we do.
Yeah, you know, Craig, the old mission statement, I just was always impressed with how much that was reflected in the everyday operation of the hospital. And almost everybody you talked to understood what all of that meant. And I'm sure with the way that you've approached getting everybody involved, that we'll experience the same thing with the new mission, vision, value. I think it'll be quickly adopted and it'll be reflected in everything that we do.
So we definitely did pull inspiration from our previous mission statement. So that's great. And so what is the new mission statement?
Well, Dr. Clemente really captured that to lead our communities to well-being. And then you add the other part, which I think is extremely powerful, one person at a time. And it's really the realization that healthcare is an individual sport. You can't anoint the masses and heal everybody. It's a one by one person relationship between the caregiver and the individual that has the need. And that's how you do it. And you can do a lot of things on the preventative side. You can do a lot of things on the curative side, and then a lot of things on the ability to take that broader to population health, where you're affecting a lot of people and making changes, how you're supporting a population a little bit differently. So it's one person at a time, but you can also affect the health status of a community through different programs you can implement.
The last part, excellence, empathy, integrity, and accountability.
Those were very strong words, and we had a lot of discussion about those. We wanted, and based upon the charge, to make this a little more condensed, those words needed to be self-explanatory, and they needed to be real, and they really highlight the main focus of who we feel we are. So excellence, of course, is excellence in everything we do. It's not good enough to say we're really good last year and we're going to slide into this year. I joke that you don't tell patients that, well, you should have been here yesterday. We were really good yesterday. You have to be on your game in healthcare every single day, every single patient. And that patient needs you, and the needs are different from the one that you saw yesterday. So excellence is a huge one. Empathy is a realization that, some things are not curative. Some things are not a quick fix. And empathy is a human emotion that we all want to translate to our patients that come in and the families. So empathy is a real human-to-human piece. We did not want to lose the human-to-human contact of what we do and not lose that by making sure it stood out in our mission, vision, values. And integrity is, like the word describes, doing the right thing all the time and making sure that you're consistently following rules, regulations, and abiding by all the best practices you can, keeping the integrity of our care strong. That means we have to have everybody on their game, and the things that we do to make sure everybody is on their game. And it's not good enough to say it. You got to go back and you got to check it and you got to test it. And that's what we do. We have constantly going back and testing the things we have out there for whether it's quality, corporate compliance, you name it. So integrity for us is a very strong word. And accountability. And that's accountability to the community, accountability to our physicians and our nursing staff on the front lines, supporting them, making sure they have all the tools they need to provide the best care possible, and accountability to our community. So this is a very strong word that says we're all accountable to someone or a lot of people. And so that is where that word comes in, because we do feel a tremendous amount of responsibility to give people what they need when they need it.
So as we are starting to, as we show our community and our patients some of our new values, I really think that they'll be able to, with the shortness, but the understanding of the mission and value statement, they'll be able to understand. I can remember this really quick now. So,
All right.
So hopefully
We've succeeded there.
our patients can do that as well. Especially for me, going out in the community, leading our communities to well-being one person at a time, because we all know in healthcare, it's that one person each time that is really the most important person at that time to our organization. How will this change impact our community?
Dr. Clemente might want to point out some of the things our medical staff does in regards to.
Right. I'm going to, and I'll come back and ask each one of you how, from a governing board standpoint, from a medical standpoint, just an overall standpoint. So Dr. Clemente, from a medical staff standpoint.
From a medical staff standpoint, people are used to coming to the hospital for healthcare. But with everything that Reid has done to become a regional health center, sometimes people don't necessarily understand why we do what we're doing. They'll say, well, why are you buying that property? Or why are you encroaching on that community. So we go back to leading that community through health. And it's a way that we can help them envision what we are envisioning, which is patients, one patient at a time, but helping the community to help themselves as well.
And from that standpoint, people don't understand a healthy community actually attracts jobs,
Right.
and just the overall well-being of the community. And Mr. Oprah, from a governing board standpoint, and you're looking at the overall big picture of 8 counties and 2 states.
Well, as a governing board chair, and even anybody that's on the governing board, one of the things we want to do with the governing board is to represent the communities we serve. So we try to have a really good cross section of folks on the board, so that we have our ears on the pulse of the communities we serve. Recently, we have a community benefits committee. It's a subcommittee of the board as a whole. We are renaming that the Community Wellbeing Committee, because we think we can do even more than we've done in the past to serve the community by understanding more what some of the needs are that we don't see until somebody's sick. We may be able to see some of the things that are going on, lifestyles, health, socioeconomic conditions, et cetera, et cetera. We'll be able to work with other community organizations to have a better handle on that and bring that back to Reid Health, so that we can perform that part of
And
it.
before Craig starts, I just want to reiterate that we do have a wonderful cross section of people. And it's not, a lot of times people think it's only people from Richmond or Wayne County, but it's from all the counties that we serve, a very big cross section, so we can get input from everyone that's on our governing board.
Absolutely.
We do have subcommittees, and then we do ask even additional people in the communities to join those subcommittees. And so that's another opportunity for us to get more feedback from the communities from which they come. And that's kind of our bench strength too.
No, great. And Craig?
Yeah. I would maybe shift a little focus down to our vision, which includes healthier people, thriving communities, and trusted partners. And that, to me, describes a very broad-based initiative. We know our mission statement is focusing on that one person, but Tom mentioned about the well-being committee. That gets into not just what Reid does, but how we partner with other people in the community that have similar focus and similar missions as we do, that all align and intersect with health and health improvement. So in other words, we don't have to be all things to all people and the only provider of health services to bring our community along to this destiny of having these folks lead our community in well-being one person at a time. The partners that we align with and amplifying their mission gets into a whole nother sector of how we can spill into parts of the community that we're not directly serving. In other words, we're still an acute care hospital and we still have physician practices. So we have a boundary line of what we do well. We don't want to stretch that and do things that we don't do well. But we know there's other people in our community that do things that we don't do and do them extremely well. Sometimes they suffer from a lack of resources. So among the things we can do to support them is to continue to give them the resources they need to amplify their mission. And when you say communities, I often look at us as each county has their own little story, their own little challenge. And we don't have to look at this with one big magic wand and how we're going to change things. You have to dissect and get into those community issues and find out what sort of problems they're having and try to get to the sources of the things that are generating problems, but looking significantly at one community at a time. So when we say community, we kind of think everybody in one big community, and we are. We'd like to obviously think of us all together like that, but the problems have to be dissected individually.
Absolutely. The another thing is, as we have this great rapport in the community, and with the well-being, we also have a community needs assessment that we work with. So it's not by working with people in the community, as well as finding and having those committees. And that's another way we get information on what's going on in each individual community.
Absolutely.
So the next thing is, as we're looking at that and we've seen the impact, and how will that affect our workforce?
It's another good question. Our workforce is different than it was 30 years ago. Things have changed. What the expectations are of a workforce with their employer have changed. And we have to change with those times. There's different needs, different outlooks, different skill sets. And part of us bringing on new employees is to bring them into the Reid culture. So that is another dynamic piece of making sure that people are aligned coming into the organization that are going to perpetuate our culture, which we think our mission, vision, values surrounds and amplifies and also defines our culture. So first, getting people into the right mindset as to what are we trying to accomplish here. And so our workforce is the most critical part that we have. In other words, I don't think you would ever want to be treated by a robot for healthcare. There is something that is so unique to human beings about the human touch and the human connection that's part of healing. It's really hard to define it. I'm sure Dr. Clemente could probably talk about all the different aspects of that, but it's not found through a chemistry test. It's not found through an X-ray. There's something about all the other parts of the human emotion that go into healing and the mental part. As you looked at our last mission statement, wholeness in body, mind, and spirit. So we knew that 30 years ago. We have not strayed away from that because we know the human part of healing is everybody that comes in contact with the patient. It's also everybody that comes in contact with the family, because we need the family on board to support their family member. Because when they leave here, they're the eyes and ears and the hands that have to continue the healing part of what we set out to do to make that person better. So our employees are critical in relaying that human part of what we do for care.
You know, Sherry, one of the things I've learned coming from manufacturing is that healthcare is probably the most complex business that I've been associated with, and it's ever changing. And so something like a really good mission, vision, and value will help our employees deal with those changes. And I can tell you that they do really well now. Just constantly, there's changes, things they have to do. I know that physicians can tell you how much of a burden that puts on them, and the nurses and everybody that's involved in healthcare is constantly seeing change, and their willingness to make those changes and adapt to those changes so that we can perform our mission is pretty well done. And I think some of the tools that went along with the new mission, vision, and values will help Craig see that too.
When we're out, and just part of what I do at Reid and out in the community, one of the things always, and I'll point this to you, Dr. Clemente, I have a joke that when you're talking about, again, being operated on by a robot, I will always tease some of the surgeons saying that, people believe that you're back having coffee and the robot is doing all the work. So, but fortunately, we have the information that we teach our community very well, and they understand. And we're always excited because our medical staff and our entire staff always comes out in the community. We're willing to go out in the community, explain the various health topics. So it teaches our community, and just part of that whole healthier people, one person at a time. So as they learn, then they can help their families.
Right. That's right. Yep. So one of the most important parts of providing healthcare is not just treating the disease, but teaching and expanding the knowledge and understanding. And in a nutshell, these new mission, visions, and values, always for all healthcare staff here at the hospital, it grounds us into telling us what we do, how we do it, and how we see ourselves doing it. And a simpler format that we've been given here is going to go towards better education for the patients.
Great. Well, I want to thank all of you for joining us today on Reid Beside You. And we're excited that the community will learn our new mission and vision statements. And once again, we want to thank Dr. Clemente, Tom Hilbert, and Craig Kenyon for joining us today on Reid Beside You. Thank you.
Thank you,
Thank
Sherry.
you.
Hey, Sherry.
Take your time.